treatments differ. Well, hello, friends. Great to have you tuning in here. Tuning in, I guess that's kind of an old world. Just checking this out here, Kettering Health Chats Live. I'm Dan Edwards. Thanks so much for joining us. We do appreciate it. And if we had a shingle right now, we would hang it out because the doctor's in the house. There's another old term for you, I guess. But we want to talk to a doctor, an expert, if you will, at Kettering Health. And we're going to get real in real time. And as you are logging on, we see folks are logging on as we speak here. We want to share some details of what we're going to be doing here in the next half hour. It is a live interactive forum for you to ask questions of our expert from Kettering Health. And today's topic is one, unfortunately, that I bet many of us have had to deal with through the years. It's stroke recovery and awareness. So if you have any questions about that, maybe you've got a family member just diagnosed, maybe yourself, maybe you have some issues that you really would like some more details about. Well, this is your opportunity. For the next couple of minutes here, we're going to be focusing on you and some of the issues and the important health topics that are concerning you. So please, if you would now weigh in, we want to get those questions to you, okay? And from you, so I can pass them along to our expert. And again, our topic is stroke recovery and awareness, if you're just now tuning in, okay? So submit your questions, utilize the chat feature on your Facebook, if you would, and submit those questions, and we'll get as many answered as we possibly can in the time frame that we have, and I'll share your questions and comments with our Kettering Health experts. So don't delay, chat now. It's absolutely free consultation for you tonight, all right? And again, if you're just joining us, the important topic is stroke recovery and awareness. Who says doctors don't make house calls? She is tonight. So let's welcome our Kettering Health expert, Dr. Megan Skidmore. You see here, Dr. Thank you, from the Neurorehab and Balance Center. And just a little bit about Dr. Skidmore. She's a physical therapist with over 12 years of experience, and she earned her undergraduate degree from the University of Kentucky and her doctorate of physical therapy from Ohio University. And she specializes in rehab for patients with neurologic impairments, such as stroke rehab, also Parkinson's disease, and multiple sclerosis. So we're going to talk to her about those topics as well. And she's celebrating 8 years with Kettering Health in May. And Doctor, thank you so much for your patience as we set everything up here with our Kettering Health Chats Live. Yeah. Welcome aboard tonight.
Thank you. I'm glad to be here.
Look at that smile. Fantastic. And a fun fact about Dr. Skidmore, in her free time, like that ever happens, Dr. Skidmore enjoys spending time with her 2 young kids, coaching her son's soccer team, and hiking. And Doctor, where are you from originally?
I'm just from down the road in Liberty Township, right by Westchester.
Another fun fact, this is her very first Kettering Health Chats Live, right?
Yes, it is. Yeah, it's good to be here.
We've got about 117 people tuning in, and she says half of them are her family. So anyway, we're glad that you're with us. Now remember, in the chat session, if you have any thoughts, any questions about what we're speaking about tonight, stroke and recovery, please get those to us and we'll relay your questions. All right, let's just start out with the basics, Doctor. What is a stroke?
So a stroke is basically when part of your brain isn't getting the oxygen or the blood flow that it needs, and so that part of the brain isn't sending and receiving the signals that it needs to function properly.
How common are they?
They're pretty common. I don't have an exact number for you, but I know that most people know someone who's been affected directly by a stroke, in their family or their neighbor or they themselves.
Sure. What are the signs of a stroke, an oncoming stroke?
So the big thing that we hear now is the acronym FAST, which just makes it kind of easy to remember. So the F is for face, meaning any kind of facial asymmetry, right? If someone smiles and half their face is droopy, or their eyes aren't symmetric or closing right, or even they stick out their tongue and their tongue is deviated to one side. The A is for arms, so you can, if you're worried about someone having a stroke, you can ask them to raise their arms, and if they're uneven or the one is drifting off or down, that might be a sign of a stroke as well. And the S is for speech. So if someone is having trouble finding words or even physically forming the words, or just speaking kind of nonsensical things that don't make sense, that's another concern for a stroke. And then the T is for time, which is just because it's so important that if you are worried that you or someone is having a stroke, it's so important to get medical care quickly and immediately. But those are kind of the more common ones, but there are other, if someone develops difficulty walking or any vision changes, those can be concerning for a stroke as well.
Real quick, let's jump to a question here, doctor, if we could. Does stroke and brain blood go together? I think they meant bleed there.
Yeah, there are different kinds of stroke. So one is when the blood flow is cut off for a certain reason, often a clot maybe that is blocking blood flow from getting through to a part of the brain, or a brain bleed is called a hemorrhagic stroke, and so they are two different kinds of strokes.
Both severe though, correct?
They can be. Anything depends on how long the blood flow is blocked, how big of an area is affected, that sort of thing.
So that the seconds that you waste thinking, well, I don't need to go, just to be precautious, just go, right?
Yes, yeah, because I've met people who say, oh, I was having some trouble walking and I thought I would just sleep it off and see how I feel in the morning. Don't do that. There are treatments that can be really helpful, and some of them have to be given within a certain window, and if you're outside of that time window, they can't give it to you anymore. So it's really important to go get those addressed right away if you're at all concerned that you're having a stroke.
Sure. Hey, let's slip in another question here, doctor, from Lily. She says, are TIAs small strokes, and will you eventually have a stroke if you have TIAs? Good question, Lily.
So a TIA is also known sometimes as a mini stroke, and so it is a small stroke, and by definition though, any symptoms or effects of a TIA are gone within 24 hours. So if you've had a TIA, you are at a higher risk of having a stroke than someone who's never had one before, but it doesn't necessarily mean that you will have a future stroke. You just know that it elevates your risk, and therefore you want to take control of the other risk factors for stroke that you do have control of, right? Like we know that diabetes and high blood pressure and smoking and those kinds of things increase your risk of stroke, and those are things you can control with medication or your habits and that sort of thing. So some of that stuff's out of your control, right? Once you've had a TIA, that's out of your control. So you want to control the other things that you can.
Gotcha. Well, let's take a look. We do have a slide here. We want to show that what can strokes affect. And doctor, if you could kind of lead us through that slide and just let us know what your thoughts are there. Here you see it.
Yeah, so depending on the area of your brain that is affected by the stroke, you might have different kinds of problems. So some of your automatic functions, like maybe your heart rate and things like that, or even your emotions can be affected. Your mobility, that can mean anything, your arm, your leg, both. So maybe trouble walking or balancing, or maybe trouble, opening your water bottle or doing activities that require two hands. Your day-to-day tasks, like maybe getting dressed or feeding yourself or being able to walk up and down the stairs or being able to tie your shoes or drive, that sort of thing. Your communication, depending on the area of your brain affected, it can be that you have trouble, what you want to say, but you have trouble getting the words out, or vice versa. People you can speak fine, but you have trouble understanding the language, or again, even just the ability to speak itself. So yeah, it can affect all kinds of areas.
So what should you do if you suspect someone is having a stroke? Is there a test, a cognitive test you can give, or it's a feeling, you just pick up the phone and call and go?
I would just pick up the phone and call and go. And that's where, we kind of talked about fast before. You can okay, are they having weakness in one arm or one leg? Is there a vision change? Is their speech different? But if you're noticing any of those things, I would just pick up the phone or just go to the emergency room just to be safe.
So are all strokes about the same then, affecting the same areas of the brain, or does it vary?
It varies. So different parts of our brain control different functions. So you can almost map your brain out, and they have mapped out the brain to a certain extent, right? Obviously, we don't know everything. But depending on what area of your brain was affected, it might affect your language or your emotional regulation or your strength or your vision or swallowing or, all kinds of various things.
Another question, Doctor, from Andrea. Andrea, thanks for tuning in tonight to Kettering Health Chats Live. She wants to know, are strokes hereditary? My father and his sister both suffered a stroke. What are my chances that I may suffer a stroke as well?
So I would say that's something good to discuss with your doctor. But for the most part, I talked a little bit about risk factors that you can control, which we call modifiable. You can modify them, right? Okay. If you are overweight, if you have diabetes and you're not keeping it under control, if you have high blood pressure and you're not taking medication for that, or high cholesterol, if you smoke, that increases your risk.
Absolutely.
So those are things that you can control and you do have control over. Some things you cannot, right? If high blood pressure runs in your family, you can't control that, but you can talk to your doctor to manage the high blood pressure, that kind of thing. The older we get, we're at a higher risk. To a certain extent, hereditary, yeah, but there's so many factors that we can control, and therefore, if you do have a family history, it's important to stay on top of that and check in with your doctor regularly to make sure that your blood pressure is where it should be. If you have diabetes, it's managed. If you don't have diabetes, make sure that you're not starting to creep towards it, because sometimes that can happen too. So yearly check-ins are important to make sure all of that stuff is being controlled.
Like if it is hereditary, is there a particular age that you need to start kind of keeping an eye on things, or does it matter?
I would, the older we get, the higher risk we are, but we see people who, are in their 40s who have a stroke. So I would say it's always important. And a lot of those things build up over time, right? If you have diabetes and you let it go for 20 years and then you start to worry about it, you're going to be at a lot higher risk than if you develop diabetes when you're 30 and you start managing it right away. So I think it's always something to be aware of, but just in the matter of just taking care of yourself, Yeah.
Doctor, this is not a stretch to say that we live in a pretty stressful society now. Does stress impact your health to the point where it could cause a stroke?
So stress certainly can elevate your blood pressure, and I think that it does increase your risk of stroke to a certain extent. But again, I think if you're taking care of yourself in all the other ways, managing your blood pressure, exercising regularly, eating well to keep your cholesterol at a good level and your blood sugar at a good level, those are all good ways to kind of manage your risk.
Okay. All right. Another slide we want to pull up here if we could, Chris. How long is the recovery process?
Yeah. So recovery, right, starts right away after the stroke has been discovered, right? Either blood flow gets back into the area, or they stop the bleed and the brain starts absorbing some of the blood. Recovery happens most quickly in those first few months, even up to a year after the stroke, but there is no endpoint. Like it's not like after a year you're where you're going to be. You can continue to make improvements in recovery for, there is no endpoint. As long as you're trying something new and working towards it, there is no endpoint. So a lot of it is just about trying new activities to challenge yourself and to get some of that neuroplasticity, which we saw mentioned on that slide too. So there really is no timeline. You're going to see the most change in that first few months to year, but you can continue to make improvements, forever, I guess.
Well, that's good. This may be another question that you don't have an answer for. Do we know the recovery rates of mild to severe strokes?
So a lot of that really depends too on a lot of things, right? How long was the blood flow cut off from that area of the brain? How much of the brain was affected? How quickly did you get treatment to get blood flow and oxygen back to that area of the brain? How quickly did you start rehab? And then other things like, what are your other health factors, right? If I already have a lot of arthritis in my leg and it's making it really hard for me to walk, and then I have a stroke and it makes it even harder for me to walk, I'm going to have a lot harder time than if I was healthy to begin with and I'm pretty strong to begin with. So there's a lot of factors at play that determine how much you'll recover or how bad your stroke is to begin with even.
Fern has a question here. If you have heart disease and have a stroke and brain bleeding, does it go hand in hand?
I'm not sure I understand the question, but heart disease does increase your risk of stroke. So, yeah.
It could go hand in hand.
Yeah.
Okay, fair enough. So how does rehab affect the brain? You say that it can rewire. It's, the body is an amazing thing. And does it amaze you sometimes how quickly people can adjust and be rewired, so to speak?
For sure. So that term I mentioned, and you might have saw on the slide, was neuroplasticity.
Yeah, I don't want to say that word, so I'm glad you did.
Right, so that is our brain's ability to kind of rewire and adapt.
Sure.
And this is a process that goes on your whole life, right? Not just after a stroke. But this is what we're really trying to take advantage of in your recovery after a stroke. So you can see there where when you have a stroke, it's kind of like one of those pathways between your neurons, your nerve cells, gets cut, or there's a blockage for some reason. Blood flow's not getting through, or there's a clot or a bleed. For some reason, that pathway is gone. And so your brain can actually work to kind of create new pathways or change pathways or take over, assign new roles to different cells or different parts of the brain to recover the function that you're missing. So rehab's job is to really, in therapy, enhance your ability to take advantage of neuroplasticity. So we know that rewiring can happen. It's best earlier after your stroke, so you're going to be able to take advantage of that if you start therapy quickly after your stroke. But we also know that other things influence how well that happens. There's more research now that shows that higher intensity exercise actually improves your brain's ability to do some of that rewiring.
Just the blood flow, or?
It seems like it, yeah. So it affects some of the different chemicals and the ways that our nerves communicate with each other. And so we're working more in therapy now on really getting people working harder. We're even monitoring their heart rate during therapy to push their heart rate higher in a safe manner, obviously.
Sure.
So, we're monitoring that and we're pushing people to work harder because now we know research shows that hard work really makes your brain more able to make those new connections.
Fabulous. That's good news.
Yeah.
So you're at the Southview campus, correct?
Yes.
So walk us through what type of therapies that we have available. I think at slide 4, if we can pull that up.
Yeah, so at Neurorehab, at the Neurorehab and Balance Center, we have speech therapy. And, depending on your stroke, right, if you're having trouble with speaking or with swallowing or with communication because of language difficulties, they can work with you on that. We have occupational therapy, we have driving rehab that our occupational therapists do to help you see if you're ready to drive, or even cool things like making your car have a left foot accelerator instead of a right foot accelerator if your right foot was affected by your stroke, for example.
Gosh, you don't even think about things like that.
Yeah, it's really cool. They have a driving simulator actually too, where you can, not like a video game, but kind of like a video game, right? You can kind of test yourself in a safe way. Our occupational therapists will assess vision because sometimes that's affected by stroke, and they can kind of intervene with that. Sometimes it's looking at your hand and arm function. Sometimes it's a matter of helping you figure out how you're going to get dressed, or how can you manage in the kitchen so that you can make meals, that sort of thing. And in physical therapy, we're usually working more on your strength and your mobility. So like maybe getting in and out of bed, or maybe walking, or maybe being able to walk in the community again.
Wow.
And so we've got all kinds of stuff we can do. That slide mentioned body weight support training. So, you know, we have a harness system at Neurorehab where we can actually hook people up and unweight them a little bit so that it's easier for them to walk on the treadmill or over ground and get moving that way. And that helps, again, get that heart rate up and get people on their feet and walking again to take advantage of some of that neuroplasticity, that rewiring in our brain.
So we see there, Doctor, the Sabo and Bioness therapy.
Yeah.
So share with us a little. I think we've got a couple of photos of that in action too. We can share here.
Yeah.
There you go.
Oh, so the gentleman on the left in the yellow shirt is using the Sabo, and it kind of helps him use his fingers and his hands. So he's doing skills with his occupational therapist there to work on getting some hand function back, some finger function back, and the Sabo is helping him to do that. And so we know for neuroplasticity too that it's very experience dependent, meaning if you don't use it, you lose it. So he needs to use his hand in order for his brain to recognize that there's a problem and that new connections need to be made. And so the Sabo is helping him do that. The Bioness actually uses electric stimulation to send messages up to the brain and to the nerves and muscles themselves to get them to fire. So the picture of the young woman on the right, she is wearing a Bioness on her leg, and that one helps pick her toes up while she's walking. So an electric signal actually goes through that little device you see there right below her knee and stimulates that nerve and muscle to fire and pick her foot up as she steps over that hurdle. And so people, sometimes we use it as a training tool in therapy just while they're with us and walking. Sometimes people actually purchase those to wear all the time, and it helps pick their foot up as they're walking. If, for example, their toes are dragging after their stroke as they step, they can't pick their toes up anymore. So the Bioness is cool. We have one for the lower extremity, like you see there, and they actually have upper extremity ones too that can help use electric signals to get that hand and arm functioning again as well.
Boy, the young lady on the right there, she sure looks young to be going through this type of therapy.
Yeah.
Can children, we have another question, can children have strokes? Let's plug that in at this time.
Yeah, certainly. We don't personally work with children who have strokes. We focus more on adult rehab at Neurorehab and Balance Center. But yes, children, unfortunately, it's not very common. It's not common, but it does happen. Again, usually strokes tend to skew older in some of our older adults, but it can happen at any age. Yeah.
Just looking at that, how gratifying is it for you, Doctor, to be doing this and to see your work help people resume and kind of reclaim their quality of life?
Yeah, it's cool. That's one thing I definitely like a lot about my job. I'm working with someone now who, not necessarily from a stroke, but hasn't been able to shower in her shower in several years because she hasn't been able to have the strength to physically get into the shower. So she's been sponge bathing at her sink, and we've been working on it and building her strength up. And she came in a couple weeks ago and told me that she was able to get into the seat in her shower for the first time in a long time. And I just thought,
awesome.
What a cool experience to be able to
granted.
help someone do that.
Absolutely. And to think that you can kind of help rewire the brain there a little bit and to get these people active again. What a tremendous job, sense of feeling you must have with your job.
Yeah.
Now, if someone is still having side effects from a stroke, is there a cutoff point where we just think, well, there's not much we can do, or do you continue with therapy and will you see results?
So, like we mentioned earlier, there really isn't an endpoint in rehab after a stroke. Obviously, we're going to see the most recovery and the quickest and most dramatic changes in that first year. But I mean, we see people years out, not continuously, right? They come into therapy for a few weeks or a few months. We work on some things, teach them maybe some new things or use some new tools or devices, and then they go home or in the community and they keep working on that stuff on their own. And then, you know, maybe that improves, and they, if they need to, they can come back later and still work with us again to see what we can get now, because maybe they're doing a little better, and we can start building from there. We're kind of laying a foundation, and then we can keep in rehab building on that foundation over time and trying to make those changes and keep getting some of that rewiring in the brain.
Right. We mentioned in the intro, doctor, that you also treat patients with Parkinson's disease as well as multiple sclerosis. Do the treatments differ?
Yeah, they do. So, you know, for a stroke, for example, that's something that's kind of like one point in time. It happened and it's over, and now your body can adapt and change, and hopefully we can get some of that neuroplasticity and rewiring. Something like Parkinson's or MS, we don't currently have a cure for, and they're known as degenerative diseases, so they tend to get worse over time in different ways. But we know now, more and more research supports this actually, that exercise and rehab makes a big difference for them as well. And so the goal is maybe a little bit different sometimes, depending on where in their Parkinson's or MS journey they may be. But it's about maintaining function and maintaining a high quality of life for as long as we can, as best as we can, and kind of adapting to the changes that the Parkinson's or the MS may bring on over time, and adapting how you're functioning or how you're moving so that you can continue to participate in life and continue to be independent and moving well over time.
You know, when you have a stroke, I'm sure that it's a very traumatic event for the entire family, but particularly for the person who has undergone it. Is there a mental component to helping these people cope with what's happened to them?
Oh, definitely, definitely. You know, there are counselors and psychologists and stuff, therapists that can help deal with that sort of thing, because it's normal to sort of grieve your change in your lifestyle, or, you know, it even affects your relationships with your family, you know, depending on the stroke. Sometimes your marriage, that relationship changed dramatically because now someone's assuming a caregiver role for someone else, and that can be stressful for both people.
Absolutely.
And so I think it's important for everyone involved to get some support in some way, you know, whether that's taking time for themselves or talking to a counselor or attending a support group, or just like maybe even meeting with one or two other people who've been through something similar. I think that can be really helpful.
But you do have support groups through Kettering Health?
Yeah, we do. Yeah, so there's a stroke support club, and you know, a lot of the meetings involve the family and caregivers as well. Sometimes they're all together, sometimes they split up and the caregivers meet and the stroke survivors meet. But yeah, Kettering has a stroke support club, and they were meeting once a month pre-COVID, and I'm pretty sure they're getting back into that at this point now.
Yeah. Any lifestyle modifications that, I mean, I think you talked about this, keeping your weight down, stay active, those type of things. Anything else you want to add to that as we kind of wrap things up here?
I think really just, you know, if you can, don't smoke or try to quit smoking, right? All things in moderation, you know, ice cream, alcohol, whatever your vice may be, in moderation, and being active. Honestly, our culture is so driven towards sedentary lifestyles, right?
Particularly during the pandemic.
Yeah, and a lot of our jobs are at a desk, and then a lot of our entertainment is seated, right, on our phone or watching Netflix or whatever. And so being active obviously lowers your risk for a stroke and helps manage a lot of those things like the blood pressure and the diabetes and all that stuff we mentioned. But it also, again, makes your body stronger and more able to adapt when you do have something like a stroke happen. If you're starting from a stronger and healthier place, you're going to be able to recover and move more easily.
Good advice.
Yeah.
Good advice. Or you get a watch like I have that says, "Hey, dummy, stand up and move."
Whatever
I really
works for you.
appreciate that. Sometimes
Yeah.
you sit there for an hour, you go, "Time to stand up." Oh, okay.
I know. It's kind of cool though, right?
It is. I
You
mean,
can-
use the technology that we have, right?
Yeah, you could even like make it a competition with your friends or your family, right? How many steps did you get
Exactly.
today?
How
That
many
sort of
rings did
thing.
you complete?
Yeah,
I get it.
yeah.
I get it. Well, Dr. Skidmore, thank you for your time this evening. Great information. Really
Yeah,
is.
thank you. It was my pleasure.
And any final words of advice other than stay active, stay healthy? Right?
I would say stay active, stay
Okay.
healthy, and if you have had a stroke, there's always hope that you can continue to make improvements.
Absolutely. Stay positive
Yes.
mentally.
Yeah.
Well, we appreciate your time, your expertise, and obviously your passion for this important topic. Thank you,
Thank
Doctor.
you. Thank you very much.
Well, we have run out of time, but we have not run out of resources for you to help you kind of get more information on stroke prevention and recovery. And we want you, when you get a chance, you have questions, always have this resource. Bookmark this website. It's ketteringhealth.org/stroke. And there's more to that, but once you get to that stroke portion, they'll take you in. And we do appreciate you being with us tonight. Now, Kettering Health Chats Live, we'll have our next one coming up May 31st. And we want you to log on and view us on Facebook, where the topic is going to be heart health with Dr. Joffrey, focusing on AFib. Yes, where your heart skips a beat. Okay, it's okay when you're in love, but otherwise it's not a good thing, okay? So it can be very dangerous to you. Not love, AFib, okay? So learn about heart health as well as the treatment options are going to be helping you live a healthier life, and we will have updates for you on Facebook. And I'm Dan Edwards. Thank you so much for joining us tonight, Kettering Health Chats Live. And on behalf of all of us here, we hope you have a safe and healthy evening, and we'll see you next time on Kettering Health Chats Live, all right? Kettering Health, be your best.